Hello, I'm Dr. Paul Homoly, and this video lesson is the third in our series of distinctions in dentistry. Here is an essential distinction in dentistry that many dentists and team members miss. That distinction is the difference between a sales versus a leadership approach to case acceptance. I remember listening to a dentist present a treatment plan to his nervous patient. After he completed his exam, he placed the mouth mirror on the bracket table, and with his patient still in a reclining position, he pulled the mask down over his chin and pointed to the radiographs on the monitor and said to her, "You need 7 crowns and root canals." He spoke for another few minutes describing the procedures, accessing the pulp chambers, instrumenting the canals. You get the picture. Following this, he emphasized the urgency in starting treatment today, warning her if she didn't, she'd probably lose her teeth. Now, this dentist knew his patient's clinical needs. What he didn't know is when he left the operatory, his patient broke down in tears. During the 20-plus years I've coached case acceptance, this was the worst example I've ever seen. However, I've also witnessed the best examples. The differences between the best and worst examples are rarely a matter of a dentist's clinical skill. Instead, it's a matter of their point of view and their language skills. Dentists who are the least successful with treatment acceptance solely see it as a sales process. The most successful dentists see it as a leadership process. Increasing transactions is the focus of the sales process. The more transactions, the better. This ushers in a sales-like experience for new patients. These include discounted fees to attract as many new patients as possible, and overemphasis on same-day dentistry, overcoming objections, closing the sale, and creating urgency where none may exist. Now, the sole marker of a successful day in a sales-oriented dental practice is collections. Now, building quality relationships with patients and providing standard of caring experiences are the focus of a leadership process. This intention leads to more strategic marketing, attracting manageable numbers of new patients. It establishes personal connections. It discovers benefits patients are seeking from care, and it seeks to understand how dentistry must fit into their lives. There are multiple markers of a successful day in a leadership-oriented practice. These include minimal stress, a sense of fulfillment, and you ready for this? Robust collections. The irony here is that although a leadership approach doesn't focus on closing the sale, it results in greater collections. The best dentists, the best practices get it. Better relationships lead to increase collections. If improving your new patient experience and treatment acceptance is important to you, consider visiting Treatment Acceptance Mastery. Our next video lessons will take us deeper into building relationships with patients and our leadership approach to the new patient experience. Thanks for listening.